So today I will discuss about thyroid gland and its disorders in brief. Many times it happens that common people find difficult to understand what is written in report, like who is TSH, what is T4, what is T3, what is hypothyroidism and what is hyperthyroidism. So in this video I will discuss briefly about thyroid gland, how it works, how it is regulated, and how different disorders of thyroid gland manifest. So thyroid gland is a butterfly shaped gland situated in our neck, and it produces two hormones, namely T4 and T3, and these hormones are converted into their free forms in the blood, and that is called free T4 and free T3. So free hormones are more important than total hormones, so generally we measure free T4 and free T3 to get an idea about thyroid gland function. And thyroid gland is in control of the brain, namely two organs called hypothalamus as well as pituitary gland. So hypothalamus produces a very small hormone called thyrotropin releasing hormone. It is called TRH, and this TRH acts on pituitary gland, which is also situated in our brain, and this pituitary gland produces TSH, that is thyroid stimulating hormone, and this hormone, as the name suggests, stimulates thyroid gland to produce more T4 and T3. So TSH is not produced by the thyroid gland, which is a common belief for many layman people, and thyroid gland produces more, mainly T4 and lessly T3, and this T3 is converted from T4 in the blood as well. So if it happens that if T4 and T3 levels are low in the blood, it is sensed by hypothalamus and pituitary, and so this hypothalamus and pituitary will produce more TRH, ultimately TSH, and this TSH acts like a whip to the thyroid gland, and it pushes thyroid gland to produce more T4 and T3. And vice versa, if the thyroid hormone levels are high in the blood, it happens in an inverse way, that due to high T4 and T3, the brain and pituitary shuts down, so there will be low TRH and TSH. So in hypothyroidism, T4 and T3 are low and TSH will be high. As well as in hyperthyroidism, TSH will be low and T4 and T3 will be high. And this is just a common understanding, and I am talking about primary thyroid disorder. So in central hypothyroidism, which is another term to understand, both will be low, but for common people, for a primary thyroid disorder, which are more common than the central ones, mainly high TSH and low T4 T3 is called hypothyroidism, and low TSH and high T4 T3 will be called as hyperthyroidism. Now it is understandable that hypothyroidism will manifest as the patient gains weight. So hypothyroidism is associated with low thyroid, and as we know that thyroid controls majority part of the body in terms of metabolism. So in hypothyroidism, our metabolism will be so slow, so we will have intolerance to cold, we will have growth failure. It is also associated with puffiness of the face and weight gain, dry skin, constipation, as well as patient might have pubertal issue in form of either early pubertal onset or delayed puberty. There is another term called congenital hypothyroidism, in which the thyroid gland is either absent or not functioning since birth. So it is associated with a newborn born with body swelling. They may experience prolonged jaundice. There will be delayed development and mental retardation due to thyroid gland's effect on brain development is not present. So I suggest, and as the world knows, that in every newborn baby must have their thyroid hormone checked within first week of life, preferably after 72 hours of life, because it is one of the preventable causes of mental retardation. So newborn with congenital hypothyroidism should be started treatment in form of thyroid hormone supplementation within first few days of life to save the brain from deteriorating effect. So hypothyroidism, again, as we know that thyroid gland is not making thyroid hormone. So the option of the treatment should be supplementing thyroid hormone from outside, and now it is readily available in form of thyroxine. It is available as a small tiny tablet in a brown bottle, and ideally this thyroxine tablet should be consumed each and every morning on empty stomach, and gap between food or breakfast and thyroid tablet should be minimum 40 minutes. So ideally every patient should take this thyroxine tablet in the early morning soon after getting up, and after 40 minutes of this tablet, breakfast or tea or any other food item must be consumed to have better absorption of this thyroid tablet. And it is important to remember that in congenital hypothyroidism, the defect is from the birth, and lifelong supplementation of thyroxine should be continued in case of confirmed congenital hypothyroidism. Now, switching to the hyperthyroidism. So in hyperthyroidism, either thyroid gland is hyperfunctioning and producing more T4 and T3, or somehow thyroid gland is damaged and whatever the stored hormone are releasing straight away, and it is causing hyperthyroidism like picture. So hyperthyroidism is associated with high or increased metabolism, so it will result in palpitation or racing heart. It is associated with weight loss, lethargy, perspiration, and if not controlled at an early stage, it is associated with ophthalmopathy and bulging eyes. So a thin and lean patients with high heart rate, palpitation, inability to sleep, bone pain, muscle pain generally is associated with hyperthyroidism, while hypothyroidism is a disease of obesity in which the body is swollen, and it is called as the disease of the fat person, while hypothyroidism is thin and lean patient. So if we think of treatment of hyperthyroidism, we have three options available nowadays. Most commonly used are the oral drugs, which inhibit the thyroid hormone synthesis and production, and commonly used drugs are methimazole and carbimazole, though few other drugs like propylthiouracil can be used, but nowadays they are used very less. So most important are methimazole and carbimazole, and this drug should be consumed depending on the thyroid level as well as only after consultation with the proper endocrinology doctor. Another nowadays available options are radioactive iodine, which ablates the thyroid gland which is hyperfunctioning, and later on we have to supplement the thyroid hormone. And the final option is the surgery, in which we remove the thyroid gland and we supplement lifelong with the thyroid hormone. But again, this treatment should be done in accordance with the endocrinological doctor, and proper monitoring of the thyroid hormone function should be done according to the advice given by the doctor. So these are the common terms and common myths which I cleared about the thyroid gland and their disorders. I hope common people will now understand better whenever see their reports of the thyroid gland. And it is important to remember that TSH is not a thyroid hormone either. It is produced by the pituitary gland. So thyroid gland status is determined by free T4 and free T3 only. So in summary, high TSH and low T4 is called hypothyroidism, primary hypothyroidism, and low TSH and high T4 is called hyperthyroidism. Thank you.